After taking consent from one of the patient named Madhuri, who was suffering with valgus or lateral knee arthritis, I would like to explain her pre and post manual therapy treatment improvement comparison on X-ray. This is the pre-treatment X-ray. We can clearly see the lateral joint compression, that is, lateral joint space is decreased and medial joint space is increased, meaning the tibia has abducted. Because of that, the weight bearing axis, which supposed to pass from center of the knee joint in the normal knee, in this dysfunction it has shifted to lateral compartment. Upon the diagnosis with spring test, the dysfunction came to be, there was an extension lag with proximal tibia internally rotated with medial shift, that leading to the lateral tilt of the proximal tibia in relation to femur. After treatment with manual therapy, mainly mobilizations and manipulations, we restored the extension of the knee and external rotation of the proximal tibia and lateral shift of proximal tibia, that in turn corrected the lateral tilt. So with that, in the pre-treatment, with the weight bearing axis which was passing through the lateral compartment because of the lateral tilt, as you can see in this diagram, has shifted to again center of the knee joint. You can see the diagrammatic representation of the normal knee. So this comparison concludes that the cartilage is temporarily compressed because of the tilt and dysfunction rather than wearing of the cartilage. If it is properly diagnosed and treated with manual therapy, we can correct the dysfunction and restore the normal alignment, thereby restoring the normal space in the joint. So that concludes, in the initial stage of arthritis, the cartilage is not wearing out, rather it is compressed temporarily because of the lateral tilt, and that can be diagnosed and can be restored to normal. And another common question people ask is, how about the synovial fluid? See, because of in the dysfunction we found there is a loss of range, that is extension, external rotation and lateral glide of proximal tibia. Because of this loss of range or a movement, what happens is the synovial fluid influx outflux won't takes place inside the joint, and as we know, the synovial fluid secretes from the synovial membrane surrounding the joint. So as movement is lost, the pressure gradient inside the joint is lost. So influx outflux of synovial fluid, which is secreted from the synovial membrane surrounding the joint, was not happening in the lateral knee or the valgus knee dysfunction. Okay, once we restored the all the movements, that is extension, external rotation and lateral glide of proximal tibia, all the movements were restored. So pressure gradients inside the joint is restored, with which the synovial fluid influx outflux was happening inside the joint, so that the synovial fluid which is secreting from surrounding the joint was again going inside the joint. So previously it is assumed that the cartilage is weared out and it cannot be reversed, but this case study reveals that the cartilage is temporarily compressed because of the dysfunction rather than wearing out. If one can diagnose with 3 planar spring test, accordingly treatment with manual therapy is planned. It can be restored to normal alignment and normal knee joint properties.
आप अपना इंट्रोड्यूस करिए, आपका नाम?
Madhuri, my age is 63. I came for knee.
Previously you came for a knee. You can talk in Hindi also, no problem.
मैं knee के लिए आई थी.
क्या क्या तकलीफ?
नीचे बैठ नहीं सकती थी, अभी भी नहीं, लाइक, और स्टेयरकेस चढ़ने में तकलीफ होता था. चलने में भी थोड़ा प्रॉब्लम होता था.
तो
आपका ट्रीटमेंट लेने के बाद I'm fine now.
और
नेक के लिए भी आ रही थी.
नेक का क्या कंडीशन था?
मेरा पूरा नेक डाउन हो गया था, एकदम डाउन.
और
तो आपका पेन था, चक्कर वगैरह नहीं आता था. नेक पूरा अच्छा हो गया अभी, पेन भी नहीं है.
और आपके फैमिली से भी?
फैमिली है, मेरा बेटा आया था फॉर शोल्डर, एंड नाउ एट प्रेजेंट माय हस्बैंड इज कमिंग फॉर द नी. He's improving. He's improving. Yeah, he's feeling better now.
और आपका नी का मैं प्री एंड पोस्ट एक्सरे लिया.
हाँ.
देयर इज चेंजेस आपको भी मैं
दिखाया. बहुत चेंजेस है.
वो भी मैं ये वीडियो को अटैच करूँगा.
हाँ है, चेंजेस है.
थैंक यू.